hit play, you see it. Okay. Also, can you hear it? Thumbs up. People were hearing it? Okay.
The Advanced Robots and Controls Lab, also known as the ARClab at UC San Diego, is dedicated to the design of novel surgical and biomedical robots and machine learning for contextually aware robots. These technical developments are applied to solving problems in medicine and surgery. The group is a multidisciplinary team comprising of electrical and mechanical engineers, computer scientists, and clinicians directed by Professor Michael Yip from the Department of Electrical and Computer Engineering. Crane is a highly dexterous surgical robot designed to bridge precision and telemedicine within the field of interventional radiology. This project strives to move to allow surgeons to precisely manipulate a needle within a confined area, like a CT or an MRI scanner, with more dexterity than their own hand. Ultimately, this will enable physicians to more accurately and quickly diagnose and treat cancer via percutaneous biopsy and ablation therapy procedures. The Da Vinci Research Kit is an open source surgical robotic platform used in over 50 institutions around the world. At ARClab, the platform is used to test their surgical automation algorithms, such as autonomous blood suction, soft tissue manipulation, and solutions for remote telesurgery. ARClab is collaborating with the San Diego Safari Park's Nikita Khan Rhino Rescue Center to develop a handheld robotic catheter device that will be used to perform artificial insemination and embryo transfer in rhinos, with the goal of saving the critically endangered northern white rhino species from extinction. The handheld platform allows for increased control, dexterity, and flexibility in highly constrained, unseen environments, and its millimeter scale diameter allows it to easily be paired with commercially available endoscopes for improved range, visibility, and flexibility. ARCsnake is a custom-designed snake robot for NASA's Exobiology Extant Life Surveyor program. The goal of the program is to deliver scientific instrumentation deep within the plume vents, caves, and ice sheets of Enceladus and Europa in search of extant life. We anticipate that Archimedean screw propulsion would be an effective form of locomotion when navigating through the tortuous caves, and the snake-like hyperredundancy can be used to descend down the plume vents. For more information, please visit ece.ucsd.edu.
Great. Thank you so much to Professor Yip's lab for that. So now we're going to turn it to all of you. So any questions that you have about the lab, and I'll turn it over to Professor Yip to go ahead and start that.
Yeah, again, thanks everybody for joining. I will say that that filming was done in the experimental side of the lab. We have in another side of the lab that's where a lot of our analytical applied machine learning computational work is done, and obviously PhD students are sitting there and mostly working in the experimental part of the lab when they're actually doing experiments. And most of my PhD students have a foot in both. And if you look at our publications, I'd say we actually have more than 50% of that work in computation, machine learning, and control. But you know, it's always nice that we can translate that to real robots, because at the end of the day, I mean, it's all an academic exercise if you can't translate it, right? So I'll just put that out there, because that video only represented a part of the lab, and I would really highly recommend you check out our website, ucsdarclab.com, which will have not only the publications we've done recently, but also videos to support some of the machine learning and robotics and controls work that we've done that isn't represented in these videos. All right, but now I'm actually happy to open up to questions. I think either in chat or in person. Stephanie?
Hi, I have a question. This is Jetwan, and thank you for making videos. And I have a question regarding what you're just saying about. In my opinion, your lab is currently working on not only the medical machine, but also the learning-based method. But in my opinion, the medical machines such as DaVinci or other robots require very high quality and very stable manner. But the learning-based method already includes some kind of some probability. So it means that there is at least low probability, but there is some failure probability. Do you think is it highly connected in one day or in near future, or is it just opposite direction, but one just hoping that one day the learning-based method can be robust enough?
Right. So really great point. And actually, you'll notice that we've ventured in recent publications into measuring uncertainty in our robot. And so we've been applying that in different control schemes to do probabilistically safe motion planning and control using things like chance constraint planning and other methods like that. And so really good point. We are looking at it and we are actually expanding on that. We're also integrating that type of stochastic modeling and control to making sure that whatever we do learn using machine learning, reinforcement learning, or whatnot, can adapt on the fly and adjust their policies so that they are going to be as safe as possible in rollout.
Thank you.
Yeah, and that's a really good area of research, by the way.
I think currently many researchers, including you, are focusing on not only domain randomization, but also dynamic randomization, I guess. I think I read some paper from MIT that tried to solve this problem in science.
Sure. Yeah, I would say like, a lot of techniques to try to solve these problems. So we've done, like you said, domain randomization, but yeah, a lot of other ways to address it.
Thank you.
Hello, may I ask a question? Hi, this is Walter. Thank you for sharing your information and your research direction. So I do really appreciate the fact that the lab is a multidisciplinary research involving software, hardware, and machine learning, all sorts of stuff. And from my impression, it seems like the big part of it involves machine learning and AI. And I want to ask about electronic side, like what kind of research direction do you have? And do you do any like embedded machine learning, any ASIC design for robotics, that sort of stuff? Thank you.
Yeah, I would say we make embedded systems for the purpose of demonstrating our AI. We don't optimize it to that. We don't optimize the hardware for it, but we do design them because some robots we design, like you said, from scratch, and we need to just do it from scratch as well. But like we're not doing research in that domain specifically. I would say actually though, one thing that is a huge driver in the lab is computational efficiency, and as a parallel to that, memory efficiency, right? And so a lot of what we're doing could be used on embedded systems, and it's considering the fact that you might not have like a 3080 Ti or whatever it is, the next latest and greatest NVIDIA GPU on your system. But that's just like a motivating factor. It's not a research area.
Great, thanks. Appreciate that.
Other questions? I will also mention that we have more robots than were shown. We have a Baxter robot, we have 2 Canova arms, 2 grippers. We have another surgical robot coming in. We have more robots than students, which is a good and bad thing.
I guess I'm kind of curious to hear about the lab culture, what it's like working in the lab, what the, I guess how people work together. Are they working
Yeah.
a lot?
Our lab is, we have weekly meetings as a lab. Everybody kind of updates everybody else on what they're working on. And we have I have one-on-one meetings with the postdoc and all of my PhD students every week. New PhD students usually an hour. Senior PhD students, sometimes it's like 5 minutes because they just kind of do their thing and everything's fine. Sometimes it's like up to 30 minutes. Lab culture is really good. I mean, you're gonna get a biased view if you ask my students, which I recommend everybody reach out to my students if you're interested in the lab, but they probably will tell you. They've told me that they think that we have the tightest knit robotics AI lab on campus. They frequently go, when it was possible, rock climbing together, hiking, biking. Actually, just by chance, we have a little bit of merchandise that we have all the PhD students kind of get so that feel part of a community. They go to the local pub pretty frequently, as I understand, together. So yeah, it's a great. From what I understand, it's great. We also have socials every quarter. Last time, we've done a couple of hikes just because you could socially distance, but I think our next one is a kayaking event.
Cool, thanks.
So thanks for your presentation. I saw that you have a lot of collaborators in the medical community, and I was hoping you could talk a bit about how you guys work together and if you're doing any testing with their supervision.
Yeah. Well, so I can speak to that. So the collaborators we have, they are the ones that really have come to us and really put in the effort to work with us. And so I think that's really great. There's also collaborators that say, a few words that they're interested in, they never show up, right? So these are the ones that stuck around, and we've been able to do really great work with them. We go to their surgery sometimes to understand what they're doing. They will do surgeries in our, one thing that we didn't show in the video is that we have our own operating room. It's very unique. I don't know any other research lab in the US that has a live animal operating room to do procedures and demonstrate that we can translate it. That's one of the questions actually in the chat. Have we demonstrated in real life? We've actually taken some of our AI algorithms and used them to demonstrate in a live setting that they are useful. Some of the PhD students don't actually get involved in that. It just depends on how you feel about that type of work. Thankfully, we're in a space where everything is about medicine, and or anything towards that domain is about medicine, and it's towards the betterment of human lives or even animal lives, as you heard from the work with the San Diego Zoo. So yeah, our collaborators are very close-knit with us, and they give us feedback, and we often go and talk to them about what our experiences are. Yeah.
I just want to do a time check. So we have about 5 more minutes. So that's like, time for about a couple more questions.
Could you explain what the current lab is going on? What I mean is in terms of after COVID-19, I heard that some lab cannot go to all people, but some lab is not. But I think the experiment part requires the place for the build robots.
Sure. My PhD students who are working on the robots are in the lab, like even right now. So we have no problem with that. One thing I forgot, kind of building off some of the other questions is, well, you'll notice just even through the publications that we do is that we're driven by an application goal, but that leads us down a fundamental contribution, usually to AI and machine learning and robotics. So for example, we wanted to do autonomous surgery. We wanted to show that you could do suturing in real time and stopping somebody from bleeding autonomously, because there's obviously there is a need for that in first response and things like that. And we found out that in that case, a lot of your time was spent doing motion planning. And so from that, we stepped even further. It's like, why is motion planning so it takes such a long time? Well, you have to do this graphical search in high dimensional spaces, and it explodes exponentially. Well, can we get around that from a fundamental level? And so we started proposing we propose neural network method. We're actually the first to propose neural networks for motion planning. And so as a PhD student, that's the type of level that you should be considering, that you'll probably get into. You'll be focusing on a problem, but trying to find higher level, more theoretical contributions that could be broadly disseminated into multiple fields. But it will eventually be able to kind of trickle down into addressing the problem that we started out trying to address. So a lot of the first publications from PhD students you'll see are very general, high level AI contributions.
Yeah. Thank you.
I see a question in the chat that says, what are some of the qualities and skills you're looking for in potential PhD students?
Yeah, really would be useful if you had some robotics experience, but right now, I think a good understanding of 3D geometry. I mean, robotics generally gives you that kind of implicitly, but understanding 3D geometry, I think one area that we're pushing even more so now is in computer vision, integrating that with our understanding of the 3D world, and how do you incorporate that to do prediction, modeling, and obviously wrapping that into control. Some background some background in machine learning is a given, but it doesn't have to be that you were studying machine learning for the past 5 years or something like that. More on the computation side than the manufacturing side. We tend to we tend to work with a lot of masters and undergraduate students to build our robots, and the PhD students instead are doing the more theoretical contributions. I see some people laughing because I think that they've been there as masters and undergrads. Yeah.